Welcome to Humanizing Healthcare, where we talk with innovators and thought leaders who are working to make healthcare experiences more compassionate and rewarding for all. Our host is Chris Malone, founder of Fidelum Health and author of the award-winning book, The Human Brand: How We Relate to People, Products, and Companies.
Hi, welcome to Humanizing Healthcare Live. I'm Chris Malone, and I'll be your host for today's discussion. Thank you for joining us. I'm pleased to welcome Samer AbuGhazaleh, the Chief Operating Officer of King's College Hospital, London, Jeddah. Welcome to the program.
Thank you, Chris. Happy to be with you.
So one of the things we love to start with is a question about how you found your way into a career in healthcare. Is there a story or experience you can share with us about that?
Sure. Healthcare is a human profession. I was doing my master's in business in the United States in Boston. And when I finished, I was offered two job offers. One of them was with a consulting group, doing consulting for banks and other industries. And the other one was from a promising pioneer in healthcare that approached me and said, "Can you join my organization?" Of course, it was, consulting is a glamorous job, and I was really excited to be a consultant one day with the big five, PwC, etc. But then when I looked deeper, I found that I can find my purpose in healthcare, a job where you can help people recover their lives. You can help people survive. In Arabic, we say, as a verse of the Quran says, وَمَنْ أَحْيَاهَا كَأَنَّمَا أَحْيَا النَّاسَ جَمِيعًا. Whoever gives life to one person, it's as if he has given life to humanity. So the purpose in healthcare is something that attracted me to this profession, and I still get inspired by the power of healing in the industry.
Well, I think you've made a very wise choice, because I think those of us who have lived a career now recognize, yes, there are many things you can do to make a living, or perhaps even a fortune, but there's nothing more satisfying than making a difference in the lives of others. So I really commend you for that.
Thank you.
For those that may not be familiar, can you tell us a little bit about King's College Hospital, London in Jeddah, and what you are all about as an organization?
King's College Hospital, London, Jeddah is a new hospital, 150 beds, situated at the heart of Jeddah in a very prime location. We opened 9 months ago. We already see thousands of patients. We have done hundreds of deliveries already. We're very proud that we've given life to those who truly need it. And that's what we're in the industry for, meeting patient needs. King's College is one of the most promising private institutions in the city, already have achieved top percentile rank in comparison with other hospitals in Saudi Arabia. Look us up online, and you'll find amazing doctors, amazing services. Proud to be the Chief Operating Officer. The hospital will grow in the coming years to become 250-bed hospital. A very promising future for an foreign organization that has come into Saudi Arabia, has thrived and succeeded.
Well, congratulations on your success so quickly. You made a very compelling presentation this morning.
Thank you, sir.
Talking about the emphasis and the focus that your organization has on patient experience. Could you tell us a little bit more about that for those that missed?
So patient experience for us is the sum of all interactions that is built by a strong culture that will affect the perception of patients across the continuum of care. So we have started with a definition of patient experience where people are introduced to it in the general hospital orientation and the general nursing orientation. We have so many programs. We started recently with a program around training the staff on Six Sigma, from white belt all the way up to Six Sigma black belt. We have so many programs in education and customer service that we started with. That's in relationship to patient experience. But all of this is, the true north of this is operational excellence. So how can all of this contribute to reducing the suffering of patients is our main purpose in doing these programs.
Excellent work. Excellent work.
Thank you.
What are your priorities going forward? It sounds like you've had tremendous success thus far. What are the challenges yet to be addressed or to be overcome in your view?
There is no organizations with challenges. I prefer to call them opportunities for improvement. And there are many opportunities for improvement. There are opportunities to make sure that we achieve the highest scores in patient satisfaction and maintain this. Sustaining success is the most challenging or opportunities for leaders to focus on. There are challenges in terms of the mentality of some leaders in competing between different hospitals. We don't have this mentality. We rather collaborate. And I mentioned this in my panel yesterday. A neighboring hospital, a Salama hospital, a beautiful hospital with beautiful leadership. Whenever they have issues with their equipment, they send their staff to us, their patients to us. And whenever we have any issues with equipment or anything, we send our patients to them. At the end of the day, the focus of experience in the hospital is to make sure we satisfy our patients, we satisfy our staff, and we collaborate with the community for a quality of life that everybody aspires for.
Yeah, and I think that's a beautiful philosophy, that we're not competing,
Correct.
that we are working together and
Correct.
complementing.
Correct.
There are plenty of opportunities and plenty of growth, that we want to elevate healthcare in this kingdom,
Correct.
Is our priority, not to get
End of the day, patient is at the center. And once we put patient at the center and we work with this mentality, it will be a win-win for everybody.
Yeah. Yes. So you have a lot of wisdom. There are many younger professionals here who may aspire to be a chief operating officer or a leader in a healthcare organization. What wisdom or advice can you share from your experience that might be helpful for them?
First of all, I would like to say that 2 days ago, we graduated 20 volunteers. I have a strong volunteer program in the organization. These 20 volunteers came from King Abdulaziz University. They were placed in different locations in the hospital to help patients, but we also included them in our training programs for customer service. We included them in our general hospital orientation, general nursing orientation. And when they left, I asked each one of them to say one word. What stayed with me is that they were very grateful. And they said we opened their mind to the opportunities in healthcare that they have not seen in the classroom. And these opportunities are the different functions and jobs and competencies they can achieve in order to be successful in healthcare careers in the future. I call on every organization to open their doors for co-ops, for volunteer programs, for internships, so that we can create the new generation of healthcare caregivers that will be outstanding and will be inspired and aspire to achieve the best.
Very valuable wisdom. My final question, it's often my favorite, is do you have a favorite quote you can share with us? And if so, why is it your favorite quote?
I have 2 quotes, if I may.
Of course.
One that always resonates with me is related to patients, and I mentioned it in my presentations. Patients will forget what you said. They will forget what you did, but they will never forget how you made them feel. And if we live or walk in the shoes of the patients and understand how this feeling is, and aspire to make sure that this feeling is always respected, we will achieve a lot for patients. That's quote number 1. Quote number 2, when you're working in this life, life doesn't end by the end of the human being's lifespan. Life is continuous. I believe in the hereafter. And I believe every one of us, as Stephen Covey said in his 8 Habits of More Successful Leaders, have to live, love, and leave a legacy. So each one of us has to leave behind a legacy that lives generations to come.
Well, I love the combination of those 2 quotes. One, I'm a big fan of the first one, just because I think it's those emotions and those feelings that really last. But the legacy we can leave can be connected back to that. It's how we make others feel and the impact that we have on them.
That's why I mentioned them both.
I think it's a great combination.
Thank you, Chris.
Thank you so much for your time today. It's a real pleasure to talk to you, Amer. I really enjoyed our conversation.
Lovely to meet you.
And look forward to more insights from you and your organization.
Thank you.
Thanks very much for joining us for this episode of Humanizing Healthcare Live. Please be sure to join us again for our next episode, where we'll be talking with another healthcare leader and innovator.
Thanks for listening today. If you enjoyed this episode of Humanizing Healthcare, please give it a rating, share it with others, and follow us at Fidelum Health on LinkedIn. And make sure you join us next time as we share more insights from another inspiring healthcare leader and innovator.